Hello, everyone. So welcome to the first noon seminar for the 2024-25 academic year. I see lots of people like raising hands in the back, which is awesome. A special welcome to those who are online. For anyone I haven't met, I'm Cynthia Minkovitz. I have the honor of being chair of this amazing department. Noon seminar is a time when we come together, faculty, staff, students, to learn about research, to learn about ongoing practice projects, sometimes advances in education. We do a mix of things during the year, both sort of speakers from within the department. Sometimes it may be a panel discussion that includes some of our more advanced students and faculty and staff. Sometimes we'll invite in outside speakers, sometimes folks we collaborate with, sometimes just folks we're really interested to hear from who do really compelling work. Over the course of the term, each term, we ask different groups to help organize seminars. So the DSA for our students put together 2 seminars over the year, and those are always really popular. So you'll hear a lot of different perspectives. As you all know, our department comes together around 2 very broad themes, life course and population science. And because of that, our seminars are also highly varied. So the one thing that I would encourage everyone is to please come to as many seminars as possible, even if it's not directly in what you think your area of interest is, because you'll hear from really dynamic speakers. You may learn about exciting things happening in other contexts that you may not know about. And who knows, it may actually shift some of your interests over time. So do take advantage. Hats off to the front office and Sylvia in particular, who does an amazing job helping organize our seminars and making sure we all know the topics. There are some weeks we won't have seminar. We'll make sure you know about those. And then the seminars actually get recorded unless the speaker asks otherwise, and they're put onto our YouTube channel, and you'll have links to those as well. So they're a great resource. So again, welcome to those who are joining online. I see a bunch more folks have signed in. We'll continue to offer these hybrid, but especially if you're on campus, encourage you to bring your lunch, come here. All things go, but it's great to have community and meet in person. So the origin of today's seminar and the one next week starts off from our prior chair, Bob Blum. So thanks, Bob, if you're online. But the idea here is to give you a glimpse of some of the faculty in the department, and what makes us passionate about public health. So we'll ask a group of 9 faculty today to come up and share with you just for about, a couple minutes, something that they're passionate about. It might be a historical event or an experience that has shaped their current interests. And it'll give you a little bit more of a flavor of what motivates us as faculty beyond what you might see on our faculty bio pages. So I hope you all will enjoy it. And with that, I'm going to invite Suzanne Bell to come up.
All right, thank you, Cynthia. A lot of pressure being first this year. It's alphabetical, and usually Phil is here, so I've never had to do it. So as Cynthia said, my name's Suzanne Bell. I'm an assistant professor here in the department. I'm from California, born and raised in the capital, Sacramento. Yay, I see some California fist pumps. I'm a product of the California educational system. I did my undergrad at UCLA. I did my master's in public health at Berkeley, so it wasn't until my PhD program in this department that I ventured further afield. I'm trained in demography, and my research seeks to improve understanding of fertility and related behaviors at the population level, and to identify factors that contribute to disparities in achievement of one's reproductive goals. And while this describes the specifics of my research focus, the overarching motivation that brings me to this work, to Cynthia's point, and that kind of gets me excited and energized for this work day after day, is to see all people be able to decide whether, when, and how many children to have in their lives. And in reflecting on what drives this interest in this topic and what brings me to this building, at least virtually day after day, I realize how the specifics of my answer to this question has changed repeatedly over time and likely will in the years ahead. And that's really something that I love about research and academia specifically. So what initially brought me to public health was my experience volunteering in Tanzania shortly after college, and the juxtaposition of my own fertility management experiences up to that point in time, and those of the young girls in the communities where I worked. I was volunteering and later working with an NGO that did HIV/AIDS education and testing in rural parts of the country. And I was particularly drawn to the young girls in these community, many of whom were already sexually active, others who soon would be, and for whom an unintended pregnancy could really threaten their educational advancement and their social standing in the communities where they lived. Many, I soon realized, had little to no information on pregnancy and pregnancy prevention, and there were quite few contraceptive resources and methods available to them in this rural part of the country. And this is in stark contrast to my own experience at the time. My 5 college roommates and I had all, at the time they graduated, were all on highly effective methods of hormonal contraception. We had learned about them rather easily and accessed them through, resources on campus and the campus health center. And yes, I did just reveal we all were sexually active premaritally. But I think this is a safe space to disclose such things, no stigma. And so this really was, putting into stark contrast how different these experiences could be and how that might impact our life courses as a result. And I think it wasn't just the difference between myself and these women halfway across the world, but also recognizing that same disparity existed across LA and across the US. And so this really motivated my desire to understand and document disparities in knowledge about and access to contraception and related reproductive outcomes, which is where my research career began. And then in the intervening years, my focus and passion have expanded substantially beyond contraception in parallel with the issues that I have experienced or witnessed friends and family members experience. This has meant expanding my research to include understanding abortion patterns and barriers to safe abortion, as friends and colleagues shared their experiences terminating a pregnancy with me and how critical this reproductive health care was to their lives. Pregnancy ambiguity and intentions, which I had thought extensively about and discussed at length with my partner before we ultimately decided to have children, as well as concerns about experiences with infertility, which several close friends and family members have struggled with or are still struggling with. And having had 2 young daughters, currently nearly age 3 and 1, who are adorable, and experiencing firsthand the joys and struggles of pregnancy and parenthood, I have a renewed and profound sense of commitment to ensuring that all people can decide whether and when to have a child, even more so following the Supreme Court's Dobbs decision, which in a cruel and ironic twist came down on my birthday. So all these things bring me to this work and this building virtually and in person today, day after day. And given how my own research has paralleled mine and my peers' personal experiences, check back in a few years, I'll probably be studying menopause. So on a final note, I want to welcome all the new students to Hopkins and all of the returning students back to Hopkins. I hope what I shared helps to reassure you all amidst the likely numerous shifts in focus that your work will have throughout your career and even during your degree program here at Hopkins. But underneath all that, I hope you're able to identify something constant that motivates your work and keeps you grounded in the important public health work that you will do in your career ahead. So thank you.
Thanks so much, Suzanne. Christy, welcome.
Hi. Hi, everyone. I am sorry I'm not there in person. I'll be there tomorrow if you want to stop by. But I am a professor in the department and I lead the Child and Adolescent Health Measurement Initiative. I came to the department in 2014 from the West Coast. And the Child and Adolescent Health Measurement Initiative, known as the CAMI, really focuses on promoting early and lifelong health, using family-centered data, tools, and research to drive what we know about healthy development and well-being across life into policy and practice. A couple of the things we lead is the Data Resource Center for Child and Adolescent Health. If any of you are interested in population-based data and using it for research, we try to make that easy. Let us know. We have lots of student activities and things like that. But also working a lot at that edge of research and measurement to be able to do research, to be able to look at how things are. So that's kind of what my focus is. And in particular, I'm very oriented toward possibilities and a positive approach to public health. So when we look at flourishing and well-being and anchoring to that outcome and not just to the lack of a bad thing or risk or disease. And so looking at the possibilities to do that points into the direction of addressing what I would call the social and relational roots of well-being, which we have a lot of evidence on, but we're not necessarily translating. So we have a lot of work to do, and you're coming in and we need you. But I thought I would do a tiny origin story as well, because I have been reflecting at this age on my life and how I got here and what has consistently driven me through quite a bit of challenge too, because it's hard to do work that society doesn't embrace fully yet. Especially when I started my career, there really wasn't a lot of funding to do most of the things I was interested in. And so I've had to really come from a strong inner place. And that's a message that I would want to give, is to really be at the watch of our own flourishing and passion, so that whatever we do, it's strong in us and we can withstand the challenges that are inevitable as we try to make a difference for others, but also to fulfill our own dreams in researching and making an impact in the areas that we're interested in. So I will just tell you shortly that I have always been interested in community and volunteering. And when I was about 15, I volunteered in a nursing home and loved old people and learned so much from them. And also it was a source of support for me too, because I had a lot of problems and adversity in my own childhood, in my own home. So I look back on it now and realize that I was really being supported by the people that I was supposedly helping as well. But one of the biggest issues that we had was that we couldn't really take the people out into the community very well, because they were mostly in wheelchairs, and the walkability was good, but the accessibility was really bad. So you couldn't really get into places like a restaurant or something like that, or a store, or certainly a park. And so the park was what I focused on, because I really saw how important it was to people to be in the presence of other people and children and nature and birds. And so I basically took a data approach, where first I interviewed people about why they would want and what value they would get out of being able to go to a park and be in nature and with other people. And then actually counted up the steps that it would take to get to the park, and then the danger that could happen if we tried to roll people up a dangerous little hill, and what the cost of care might be if they fell and broke their hip or whatever, and how easy it would be to fix it. And took that to, for some reason, the Chamber of Commerce. In my head, they ran the city. And basically presented this to them. And, in about 3 weeks, they fixed it. And it was before the Individuals with Disability Act came through, the American with Disabilities Act, where you had to make things accessible. So to me, I think it got all the way in, and I was sort of naive. I didn't realize, if you do this, things can change. I just thought that's the way the world worked. And so I think that's really a lived experience that I had that was a success, that really set me on a course of believing how possible it is when people come together and yes, bring data and research together with lived experiences and stories to motivate and see change. So that's my short story. I hope I was short enough.
Christy, you were a rabble rouser from an early age. That's awesome.
Yeah, I know.
So I love the story. Thanks so much for joining us. I'm going to invite Carolina Cardona to come and join us and say hello.
Thank you, Cynthia. Hi, everyone. I'm Carolina Cardona. I'm an assistant scientist in the department, and my research focuses primarily on understanding women's sexual and reproductive health behaviors from a health economics perspective. I really enjoy participating in these talks that we always have at the beginning of the semesters, because I get to hear why people do the type of work that we do in this department. The story that I want to share today is about how I started a career in public health, which dates back to shortly after college, when I was working as a research assistant of a project that was evaluating a randomized cluster trial that was conducted in the peri-urban areas of Bolivia. And in this project, the overarching goal was to reduce the prevalence of cervical cancer. And the way that the project was aiming to do this was by working with community health workers who are responsible for going into the treatment areas of this specific region of the country and they had to share information. First, information about what is cervical cancer, but most importantly, they were tasked with the responsibility of sharing information on how to access screening services to detect cervical cancer, specifically pap smear tests. The reason of why this was relevant was because at that time in the country, it was part of the health insurance that was offered in the public health system to mothers. So their main task was to share this information. As a team member of the project, my task was mainly to do the data analysis and support data collection processes, but also data management, which I do love data. I'm a big data nerd, that's true to date. But what's more impacting for me was to be part of the fieldwork team and go into the villages and talk with some of the women who were benefiting just from receiving this information. And many of them would share that they were not aware of what cervical cancer was, but most importantly, they were not aware that they could access to this test free of charge without having to pay for it, just by going to a public health facility. I also had the privilege or the experience to talk with some of the healthcare providers, and they would share their perceptions of how women would go into the health facilities with little information, and that the project was helping them to grasp some of the relevance of why it was important for them to get this test in order to prevent cervical cancer eventually. So fast forward, I no longer do research on cervical cancer. My research focuses primarily on still women's health and how we can do better public health interventions to enhance their overall health well-being. Either this is by collecting qualitative data or quantitative data, but how we can do public health interventions to enhance their overall well-being. So that's my short story. I hope I didn't go above the 5 minutes. Okay, perfect. Thank you.
So what I love about these stories, even though all of our work is different, is just some common themes. So we've heard about sort of the mix of data and stories. We've heard about translation, and we've also heard about persistence and resilience. So I think you're going to hear more about these as some of our other faculty come up and introduce themselves. So there you are. So Michele Decker, I'm going to invite you to come say hello. Oh, and you have props. Ooh, very cool. Good. Thank you so much. It's such a treat to be here with all of you and be kicking off our academic year. And I think I'll continue in this thread of, we're sort of tasked with giving a little bit of an origin story, a little motivation, a little bit of advice. And I was on my way here today and I thought to myself, ooh, we're going to be gathered in Page Hall. And I wanted to really celebrate and uplift some, call it advice, that we often hear from Dr. David Page, who's here in the audience today. You're known for many things. One of the things that I always associate with Dr. Page is sort of that adage of chance favors the prepared mind. And I offer that to you and sort of kick this off for you as a bit of advice for your journey through the program, given that you're here to prepare your mind, and what you're hearing through many of these stories are elements of chance and elements of opportunity. So there's the preparation piece, but there's the openness as well. So just wanted to kick us off a little bit with that. I'll back up a little bit and tell you about myself. I'm Michele Decker. I'm a professor here at the school. I've been here for about 14 years now, and I never saw myself being a professor at a school of public health. I finished college. I was a women's studies major. I did a lot of math. I really enjoyed math. I wasn't sure what I was going to do. I was doing some program evaluation work, but I was really passionate about my volunteer work as a sexual violence victim advocate. I was taking hotline calls. I was responding and supporting people, survivors, in police statements and forensic exams. And I was really asking myself, like, gosh, this is important work, but we need to be doing so much more in prevention and survivor support. So I got quickly swept up with Masters of Public Health training, did some work, continued my work with rape crisis programs, and ultimately pursued a PhD and was able to land here as a professor. Actually, I didn't land here as a professor. I landed as an assistant professor, but have the opportunity to teach and train on gender equity, gender-based violence, all aspects from the bio to the social features of women's health that shape lives, whether they're reproductive lives, mental health lives, access to services, economic empowerment, and so on. And most recently, I've had the opportunity just in this past year to launch our new Center for Global Women's Health and Gender Equity. So come down and see us. We're on the 4th floor. And we have a cascade of research, applied research, training, and practice activities, US facing as well as global in this space. And one of the things that we're very excited about the center and all of the wonderful things, but I want to touch back on this thread of sort of resilience and perseverance. Not every day is easy. We are gathered together oftentimes because we are committed to mission. You're hearing a lot of mission drive in this so far and forthcoming. And that requires us to stay focused and positive when things are going well and on the hardest days. So when I was in grad school, I got to school early one day, as was my routine. I hopped on the elevator. Someone was kind of reading the newspaper and I was like, hey, how are you? And it was like, well, pretty much living the dream. And I thought to myself, oh, it's kind of an offhand comment. But I kind of put it in my pocket for some reason that day. And I thought to myself, gosh, living the dream, that really resonates. And so during this time that I've been at Hopkins here, I generally present at the stories of the faculty by telling you that I'm so much living the dream. I'm surrounded by amazing students and trainees. We have amazing staff and faculty, interdisciplinary, amazing methods, amazing substantive expertise in this community. And it's really, 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 really cool. So when I think about where I am now and where you might be, this is the invitation part, I really think of myself very much as living the dream. And I'm very delighted that Christina Bethell is here because a couple of years ago I presented this and a few days later she showed up at my door with this, living the dream. So this is the invitation to you all, and a thanks as always to Christina for this, and invite you to follow chance, prepare your minds, and live the dream. Thanks. So in case you had any doubts in the first week of school, we have an amazing community in our department. So hopefully you'll find that even though doors are often shut, because that's kind of how our hallways are structured, just really knocking on doors, sending emails, setting up times to meet for coffee. We'll be announcing, I don't remember which term, it's the end of first term or second term, but we're going to make coffee cards available. And all you have to do as a student is sign up and agree to take a faculty member for coffee. Like, okay, on the daily grind. So we'll do things like that throughout the year to try to make any perceived barriers just a little bit lower. But we're all here as faculty because we really enjoy interacting with you all as learners in the department. And with that, I'm going to invite Alison Gemmill to come up and say hi.
Hi, everyone. Good to see you. Welcome back. So I'm an assistant professor in the department. I'm the faculty lead for the maternal, fetal, and perinatal area of interest. And today I'm going to talk about something I've been thinking about in what I do. And my origin story is that I always wanted to be a doctor. I know there's several of you like that here. And in undergrad, there were no public health programs really. And I didn't know about public health until after I graduated, but I eventually found it. And I fell in love with research. And the reason why I wanted to be a doctor was I wanted to make a difference, right? I thought that was the way I could make a difference. And then I found public health. Okay, this is how I can make a difference. I love research. So it turns out that what I like doing is I like asking big questions. I hate controversy, but sometimes these big questions lead to controversy, right? So I'm going to tell you two little stories related to this. For my MPH training, I studied an environmental contaminant called methyl bromide. I almost forgot about it. It's a fumigant used on strawberries. So I worked with the farm worker community population, and using data from that birth cohort, we looked at how methyl bromide exposure, so based on where the women lived, so methyl bromide exposure during pregnancy was related to birth outcomes. And we actually found some pretty it was pretty terrible. We found that babies who were exposed to this were more likely to be born preterm, or more likely to have smaller head sizes, et cetera. And when this was published, about a week or two later, I got an email saying that the Strawberry Commission of California was writing back to tear my study apart. Okay, so didn't realize that was going to happen.
But that was my first foray into controversial findings, right? But it turns out my findings were so important that now methyl bromide is banned in the state. It wasn't just my study, but others as well. But that was my first glimpse into like, wow, asking big questions really matters. So turning to my next story, you might have heard that Suzanne Bell and I are working on studying how recent abortion restrictions are impacting health. And so we recently published a paper on the Texas abortion restriction and infant mortality. It received a lot of attention, thankfully. And it's funny because I was talking to a reporter and he had my phone number and he texted me when I was at Legoland with my kids this summer. And he said, oh, your paper was just featured in an interview on CNN. And I was like, oh, that's great. Yeah, okay, Jake Tapper, great, that's cool. And I finally found the clip and it turned out he was interviewing Governor Greg Abbott. That was so amazing to me that Jake Tapper actually asked Governor Greg Abbott, hey, have you seen the study? This study found that abortion ban in your state led to this increase in infant deaths. And Greg Abbott was flustered a little bit, but it's just so, I can't tell you how immensely proud of myself I am to be doing this policy relevant work, this impactful work. I hate controversy, but I'm making a difference. And this is all saying to you, ask the big questions, don't be afraid. We have support, we have colleagues to provide that support. Yeah, just go for it because you are the next generation of big thinkers and leaders. You will be asking questions that I've never even thought of. So good luck and looking forward to following you on your journey. So thank you.
I don't know, Alison, if we thought about the sort of subject matters that you do research on and saying that you don't like controversy, like, I'm not so sure. So we'll chat about that over dinner. I'd like to invite another one of our faculty, Lulu, up to say hello.
Good afternoon, everyone. Lilu here, associate professor in the department. I'm also the, I guess, head of the Health and Health interest group. Instead of offering some wisdom of pearls, I'd like to actually pose a question today and invite you to join this journey of mine to maybe figure out some answers together. So the question I'd like to pose is, how do we make our science more accessible? And I'll talk to you about maybe two stories, experiences I've been having recently that, led to the question, but also starting to have some inspirations to try to answer the question a bit more. The first story is I was in a meeting back in April. This was the Countdown to 2030 meeting. For those of you who don't know that project as much, it's a project to try to monitor progress toward the SDG health goal. And actually in this meeting, we have about 25 country delegations coming from mostly low-income countries. And I should have mentioned my work is on child mortality, or more generally, I'm trying to study and improve survival of vulnerable populations, with children in particular. So I presented on some of the results my team has been working on mortality, causes death, and then there's this question coming from the audience, right? So a delegate from I think Cote d'Ivoire was asking, oh, it's all fantastic, and you use the DHS data, which is the demographic and health survey data, as one of your major sources to the models, but what do they really do? I mean, how do they calculate all these different indicators? And it's like a black box. I was like, oh, that's a great question. In fact, their definitions of how the metrics are calculated is actually available on the DHS website. And the statistical codes, to calculating them are actually usually available from GitHub. But I think after I provided that kind of answers, I come to realize, it's not enough. It's not enough for him to sort of, process. It's not enough from the audience, because, I know actually before coming to this meeting that my audience, is not only demographers, statisticians, but also health policymakers, programmers, and, people on the ground to actually maybe, work with, clients, right? So, I mean, at that point, I was like, okay, accessibility does not necessarily mean you put them in a public domain. Go check them out, that's not enough, right? But like, how do we do more than that? Okay, I've been actually thinking about this since April, and just lucky enough, I went to a Zumba class last night. So I'm also a Zumba instructor, and shout out to my fellow Zumba instructor, Celia, in the audience as well. You know, as a, you know, fellow Zumba instructor, I'm very, coming into the class, right? I was very judgmental. I was like, gonna check out this, you know, Jeff is the instructor. I'm gonna see how good he is, you know, why is he so popular in the community, right? Okay, so going to the Zumba class, I was like, well, you know, Jeff, he sometimes did, you know, like he did things that are a bit, you know, silly, and he didn't even dance to the beat oftentimes, and like his transition between different moves are like so sudden that it's really hard to follow him, right? Like I was like nitpicking all those different things. But then, you know, you feel like, you know, the gym is packed, you know, there's probably as many, Zumba dancers as what we have in this room. And you can totally feel the love coming from the community to Jeff. And, you know, he has been, you know, he had like interactions with individual, sort of, you know, dancers, and he knows them by names. And he like, you know, and he invited, you know, dancers to the stage to dance with him together. I was like, okay, maybe this is where Jeff's charm is coming from, right? Like, you know, and, you know, like all those different level of interactions, and the fact that he's not perfect at dancing makes him a lot more, in his classes, a lot more, you know, accessible, right? Like no one felt really being judged about having to like dance to the beat or having to be perfect, right? In that sense. So, you know, actually coming out of the class, I learned from a friend of mine that Jeff has been actually serving the community in this capacity for a couple of decades already. He has actually invested, you know, in this activity. He's actually a retired NASA official somewhere. I heard. So, you know, also like, you know, not his main thing, but you know, I think this, you know, level of passion for what he does, and also this constant engagement with the communities, and not necessarily being perfect or technical, but really, you know, showing and interacting with your audience. I think some of those can be the source of inspiration for me to think a bit more about how to actually make my science a bit more accessible. But this is only the start of, you know, a journey to figure out the answers to this question. And I invite you to, you know, have the sessions with me, and look forward to the opportunity to actually learn a bit more about your work, and maybe, you know, how we can actually probably do this together. Thank you so much.
I have to say, I learn new things every time we do stories of our faculty. I always knew that for several years, Celia, that you've been a Zumba instructor, but now we have two. So I'm thinking, at least
8 years already.
I had no idea. No idea. But I think this might lead to some new social activities, voluntary, of course, but we'll chat. Well, great. That's awesome. Next on our list. Next on our list, Astha Ramaiya is going to say hello and greetings.
Thank you, Michele. Hi, everyone. Oh, this is so lovely. So I'm just as an introduction, my name is Astha Ramaiya. I'm an assistant scientist, and I'm currently in PFRH, but I'm in transition to go to HBS. But I just thought this would be a nice way to maybe, I don't know when the decision will come, but whenever it does, I'm still around. I'm still at the university. I'll just be in another building, and you can reach out if any of my work is of interest to you. So so I want to, like I said, I'm not as equipped as Michele, but I do have this prop. And I had gone to a writing retreat in March of this year, and I had been, and this is a letter that I had written to myself. So I will say what is written on this to myself, and then I will go into what this means and what my story is. So over here, I had said, focus on trying and doing the best you can. Don't look at the fruit, keep working hard and trying. The old path will continue or diverse into a new path that makes you a better person. Always be kind and appreciative. Keep working for those who are not as privileged. And I had written this to myself when I had not seen a path for myself. I didn't know what would happen. I didn't know where I would go. And I had reached a point where I wasn't sure where I was. My work and my family are my identity, and work plays a really big part. My career and what I do plays a really big part of who I see as myself. And at that point, I wasn't sure what would happen, but I have learned from all of these great giants in this room, in the halls, in the corridors, that you just need to keep trying. And as you progress through your next 2 years, I just want to say that the one thing you can do is build that network within yourselves, build that network with your faculty, and build that network in your community as a whole. And I think I went around knocking on random doors, just seeing if there would be any opportunity that I could be part of. And that opportunity came up. And when it did, there were multiple doors that opened up. As for myself, I have come from Tanzania. I was born and brought up over there. And I never had I envisioned or never had I thought that I would be here at Hopkins working in this field. And I am grateful for all my mentors and all these. And like I said, I am just rising on top of the shoulders of these mentors so that I am just able to do what it is I need to do to make this world a better place. In terms of my research, a lot of my work is focusing on gender and how gender affects health outcomes. And so my previous work in Tanzania was focusing more on maternal and child health. But when I came to Hopkins, a lot of it transitioned to adolescent health. And now it's going into death registration and understanding barriers and facilitators to death registration in low and middle income countries. And so through the core of it, I want to focus on how gender as a power system affects health outcomes throughout the life course. And if any of you are interested in any of the things that I have just mentioned, please just email me. I work mostly remotely, but I am coming to campus more often, probably once a week or so. So just let me know and I would be happy to chat. So thank you very much.
Thanks so much, Astha. Annie Smith, I think I saw you here earlier. There you are. It's like Price is Right. Come on down. I heard this morning as I was driving in on public radio that The Price is Right is the longest running game show. And I think it went back to like 2012. So I don't think I'll ever be Alex Trebek or anyone like that, but come on down.
Great, well, it went to like 1980. Yeah. Hey everyone, I was at the same writing retreat at Astha and I also got my card, but I'm going to ask Astha to write my next one because yours was much more eloquent than mine. Okay, so I wanted to talk a little bit about how I got into this field. So most of my research and work focuses on designing and evaluating inclusive and affirming sexual health education that really resonates with young people's lived experiences and with their identities. But my path here was very windy. So I was always from a very young age, very fascinated with bodies and childbirth. And like Alison, I thought I wanted to be a physician. And I remember reading a book when I was really young, and the main character wanted to be an obstetrician, and that's what I learned what an obstetrician was, and I was like, oh my God, this can be a job. That's amazing. But when I got to college, due to a variety of circumstances, I really needed to pursue a career that would, produce financial stability as soon as I graduated. And I, through a process of, elimination, selected engineering. So I became a bioengineer and worked in the biotech industry for a few years. Also during college, I had some of my own sexual and reproductive health experiences that really enlightened me to the power of sex ed and how empowering it can be for a person. So, I still always had those wheels in the back of my mind, really appreciating that work. And, it was really, after a certain point working as an engineer, I really couldn't deny that I still wanted to work in this field. I found myself like looking up articles from Journal of Obstetrics instead of like Journal of Molecular Bio, which I was supposed to be looking at. And I was having a beverage with a friend one night who offered to introduce me to two women, one Kenyan and one American, who were looking to develop a way to produce more affordable menstrual products in Kenya. So I had a short conversation and a brief interview with them, and they had just gotten some seed funding from the Gates Foundation. And I wound up joining that because of my engineering experiences. So I spent the first 2 years of that work learning how to pulp. So I also know a decent amount about pulping science and exploring different fibers to incorporate into menstrual products. And that led to me moving to Kenya and really helping to start this organization off the ground. So I learned a lot about organizational management and personnel management. I managed sales and I did fundraising. And I also managed our product research. And it was really that I fell in love with. I really loved being able to listen to what people had to say and to translate that into products. I think especially because menstrual health was like increasingly dominated by philanthropy in the setting I was working in. End users weren't making the decisions about what products they were getting. And so that's where I really found the power of research. And that's what led me here. And, once I came here, I also shifted a bit to more domestic work and then focusing more on sex ed. I did my master's here, my MPH and my PhD. But the process of applying to grad school was still a little bumpy. I had to apply to PhD programs twice, and I got a master's in the middle of that. And so it was something that I, for 3 years, was just like doing over and over again, applying to grad school. But I'm very happy to be where I am right now. And I think, some of my takeaways from my experience would be to, grad school is continuing a journey for some of you. It is starting a journey for some of you, but embrace the journey. And, life and your career can present a lot of ambiguity. There was a lot of confusion and anxiety over the years as I was transitioning across a lot of careers. And I'm not going to say that enjoy the ride, because it's not always fun, but I hope that you can sort of interpret that ambiguity and that confusion as a sign of growth and movement towards something. And my other advice is similar to what Astha said, always take those opportunities, take an opportunity to meet with somebody. Don't be afraid to reach out to your network, because often that will lead you to where you want to go. Thank you.
Well, that gives you a short flavor of who some of our faculty are. You'll meet more next Wednesday, and you'll meet many more of us as classes unfold and you start knocking on doors and sending emails. But our doors as faculty are always open, especially to students and learners in our department. It's what gets us excited to come into the door. I just want to introduce two of the staff who I work very closely with in the front office who don't know I'm going to do this, so they'll probably punish me afterward. But Sylvia, I mentioned earlier, do you want to just stand up and wave hello? So Sylvia Thomas works very closely with me in the front office. She actually makes our noon seminars happen. She keeps me grounded along with Ruth Harley, who isn't here today, but really helps the flow of activities that happen in the department. So we are especially grateful. And then sitting next to her on her right, who joined the department a couple months before some of our first years did, is Mary Alice Yeske. So Mary Alice is a communications associate for the department. And you might think, why does the department need a communications associate? Or maybe you wouldn't, because you're all very used to this. But we think about our communications both internal to the department as well as outward facing. And it's so important, as several of my colleagues said, to really translate what it is we do. Because we can talk all we want among us ourselves, but we really want decision makers, policy makers, the general public to understand what it is we do in public health. And so Mary Alice has just been an incredible addition to our department. Many of the things that you now see on the website and things that are forthcoming are thanks to Mary Alice and the team who've been putting everything together. So huge thanks. And then before we wrap up, I know we acknowledged you, David, Dr. Page, that this is Page Hall. Many of you might say, oh, it's W2030, but in our department, it's Page Hall, and it really honors so many of your impactful contributions. You'll hear a little bit more about some of his work for those of you who take MCH legislation with Sarah Reese and me in second term when we talk about the Women, Infants, and Children Supplemental Food Program. This is a big anniversary year for that program, so you'll be hearing more about that as the year unfolds. But just so impactful in so many generations of learners, and also for us as faculty in the department and a wonderful colleague. So I just wanted to acknowledge that and to thank you. And it's really great to have our seminars in Page Hall. So. And with that, while most of our seminars will go closer to 1:15, I think you get a few minutes back today. So feel free to socialize. We have the room for a little longer and look forward to learning with all of you, playing and socializing as the year moves forward. So thanks all for being here, and a special thanks to those online.